Hello, everyone, and welcome to our seminar on protecting yourself from COVID-19. I'm Lori Aldern, the Community Outreach Coordinator for Parkview Community Hospital in Riverside. And before we get started, I just want to thank all of you for taking the time to educate yourself about health issues and particularly COVID-19. These are certainly unsettling times, and the more information you have from good sources, the more comfortable you'll be with moving forward with our new lives as they unfold. Today, our presenter is Dr. Wayne Dysinger of Lifestyle Medicine. Dr. Dysinger founded Lifestyle Medical with a mission to empower people to make healthy lifestyle choices. He was previously chair of the Preventive Medicine Department at Loma Linda University Medical Center. Dr. Dysinger is an international leader in holistic care and lifestyle medicine, having served as the founder and chairman of the American Board of Lifestyle Medicine. You'll find that he's passionate about treating the whole person as naturally as possible. And please be sure to enter any of the questions that you might have as Dr. Dysinger scrolls through the slides that are on screen. Enter them in the chat section and we'll review those at the end of the presentation. So now I'll turn it over to Dr. Dysinger.
Thank you, Lori, and thank you to Parkview for hosting this webinar. I always like talking to patients and getting to know patients more, and so I'm looking forward to this time with you. So just to give you a little sense of what we're going to do, I'll be talking for around 20 minutes. And during that discussion, we'll cover these three things. We're going to tell some stories and we're going to share some data and we're going to interweave those some. Then we're going to go to three core prevention recommendations. So what does this new normal look like and what can we be doing to make sure that we're going through this new normal in a way that's safe for us? And then I'm going to finish up with one slide that looks at four things that you can focus on, not just to prevent, but actually to keep yourself safe as we perhaps come up against COVID. So this presentation will take 20-25 minutes or so, and then we're going to have a question and answer session, and we'll keep doing that basically as long as you need us to keep doing that for another 20 to 25 minutes. And at that point, we'll wrap up. So that's basically what the presentation is. And again, thank you to Lori for hosting and to Parkview for setting this up. So this is a graph that actually I should have changed, because if you were to look at this now over the last week or so, this graph is a couple weeks old, but the new cases in California are continuing to go up. We've as everyone knows, I'm sure on this webinar, Gavin Newsom has asked us to start shutting down again because we're struggling with coronavirus. Now, one of the things I like to point out in this slide is that this is the state of California. The county of Riverside is very similar to the state of California as far as the overall graph. The country of the US, of course, is quite different. We had lots of coronavirus in the Northeast back in April and early May. Now the coronavirus is going down in those areas, but coming up in the South and the Southwest. California sort of had a middle ground. So it was always a place where coronavirus was, but it's never been a place where coronavirus was hitting super, super hard. And just to give you a sense, right now, New York has still had about 8 times the amount of coronavirus per 1,000 population compared to California. So California still is not anywhere close to what New York was, but California is continuing to grow and New York is going down. So the point is, coronavirus is still very much around. It's not going away. I remember back when it started when we were really taking it seriously in March and April, it felt to me like it was a 2 to 3 month issue. but it's clearly not that. It's a 2 to 3 year issue, and potentially even longer. It's not a short-term thing. I wanted to share a few stories of patients. When we started with the coronavirus epidemic, our practice made a goal of having none of our patients get coronavirus. That was obviously not a realistic goal, and we realized that. But we care about our patients, and we want to keep them safe. So we said, this is what we're going to try. But we've had 2 cases. Actually, we've now had 3 cases. But I'm going to tell 2 stories of patients of ours who have had coronavirus, just to give you a little sense of how this can happen. So these aren't the real pictures, and they're not the real names of our patients. Obviously, we keep those confidential. But the story is the story. So Maria, a 68-year-old lady, and she lived at home with her sister. So it was just the 2 of them in the house. And when coronavirus hit, they both fully socially isolated. So they started getting all of their food delivered. They started, not going out and talking with friends or relatives. They just fully socially isolated. But both of them worked, and my patient worked in an assisted living facility. Well, this was relatively early on in the pandemic, so it was back towards the end of April, and my patient developed a dry cough and a fever. So she came to our office, and we tested. This was before the county was doing a good job of testing, and so we had the test ourselves, and we tested her, and she turned out to be positive for the COVID-19 disease. And so, of course, we had to stop her from going to work. And we went through a whole process with her where we were monitoring her temperatures and her oxygen saturations to see how she was doing as far as the breathing. One of the wonderful things about the coronavirus epidemic is that we have learned a lot in the last 3 or 4 months as far as treatment of the COVID-19 disease. And so we were adding some of the treatments that we knew about then to this patient, and she turned out to do well. So she stayed at home. Her cough and fever resolved over the course of 4 or 5 days, and she is now actually back at work. But when we analyzed where did she get this, she got it from work. So as we all know, assisted living facilities, nursing home facilities, skilled care facilities, these were the types of places where coronavirus was really running rampant back in those early days. There's been a lot of tightening down since then, which is one of the reasons why the death rate has dropped. But our patient got it there. And the idea of where you can get coronavirus, that's an important thing, because that's what we're trying to stay away from as we go through this new normal. So the second patient that we had that got coronavirus, again, not the real picture of the patient, not the real name, but this patient was a 71-year-old lady, and she also lived in a home where there was just one other person. For her, it was her husband, and it was just the 2 of them. Now she developed coronavirus a little later on. It was towards the end of May that she developed the coronavirus, and in her situation, she and her husband were socially isolating, but they had strong family connections, and they had their social bubble. So they were allowing family members in and out of the house, and they were trying to be careful. They were trying to only interact with family members who they felt were safe. But her husband would go out and do some of the shopping, so they weren't having all their food delivered. And he would use public transportation as he was going out to do the shopping. So he was on the bus and other things. And what happened is he developed some symptoms and got tested, and he was positive. And by the time that was understood, obviously our patient, he's not our patient, but she is our patient. And she was obviously living with someone who had coronavirus. So she had a lot of exposure. And so then we tested her even before she got symptoms, and she was positive as well. And then, of course, she eventually got symptoms. So we did the same thing with her. We encouraged her. We have I'll talk at the end about the things that we do to build up the immunity. So we have a lot of things that we work with as far as our patients, as far as all of our patients, but specifically if you have coronavirus, we want you to build up your immunity. And so we were working on those with her. We were checking her oxygen saturations regularly. We were staying in close contact with her. We talked with her every day as she was going through the worst part of the illness. And she was somewhat similar, where she developed the cough and a little bit of a fever, but it lasted for 4 or 5 days, and then she got better. So these are the two patient stories, and I think they illustrate a variety of things. The first is if you're in an environment like this work environment where we think it was a patient who had coronavirus that actually gave it to our first example here. So if you're close around someone like that, even if they don't have symptoms, even if it's not clear what's going on, you can get coronavirus that way. The other example is you can get coronavirus if you're out and about, like this patient's husband did. So he, there was a time frame in Riverside where we weren't wearing masks, and people were riding on the bus, and the coronavirus was still going around, and the masks weren't there, and so you can get it if you're out and about if you're not being careful. So what do we know about coronavirus? And again, we know so much more now than we did back in March. We still have so much more that we want to learn about coronavirus. But what we do know is that it's primarily spread through respiratory droplets. So when you're talking, you're producing these little respiratory droplets. Obviously, if you cough or sneeze, there's even more of them that are produced. Even breathing, there's some of these respiratory droplets that will go out. And those coronavirus, the little molecules, like the picture you can see here, they actually are in those respiratory droplets, and they'll float around the air in those respiratory droplets. Now, obviously, eventually the respiratory droplets will settle, and they'll dry up, and the coronavirus will die because it cannot live by itself out of respiratory droplets. But these respiratory, if there's someone with active coronavirus, they're going all around the air that's near those people, especially if that person's, or even more so if they're coughing or sneezing. And so we know that's the main reason, the main way people get it. Initially, we thought it might happen a lot from contact. And it appears that it can happen from contact. Again, if one of the respiratory droplets landed on something and then you touched it immediately, and then you touched you put your fingers in your mouth, then obviously you could get it that way. But it's pretty rare that it happens that way. So we're not so worried about it showing up in our house on food that was bought in the grocery store. The coronavirus isn't going to sit on that food all the way to our house, and then as it sits in our refrigerator, the coronavirus will go away if there's that type of exposure. So it's mainly these respiratory droplets. The other thing that we've learned is the dose matters. So our bodies, assuming we have reasonably good immune systems, our bodies are good at recognizing foreign things that come into our bodies and at attacking those and getting rid of them. And so with small exposures, our body seems to be able to attack coronavirus and get rid of it. But if there's a large exposure, so if we get a lot of these viruses in these respiratory droplets, someone coughed over us, or we're living in the same room and breathing the same air, then that's a high exposure. And that seems to be when we actually get the virus. So small doses, not so much, but large doses, it's pretty likely that you'll get it. The other thing that we've learned is that your overall health matters a lot as far as whether you get the virus and what happens when you do get the virus. And again, at the end, we're going to talk about that more. But the thing that it highlights is building your immune system is incredibly important. The stronger immune system you have, the less chronic diseases you have, the better off you'll do in this coronavirus. So one other set of data, you can see two graphs here. The graph on your left is from China. And what this is showing is the death rate of COVID-19 patients with pre-existing conditions. So you can see there that if you had heart disease, about 10% of people with heart disease actually passed away. If you had diabetes, about 7% of people with diabetes actually passed away. You can see the other numbers there for respiratory disease, high blood pressure, and cancer. But if you had no chronic diseases, it was less than 1% of the population that actually passed away. So we learned then that there was like a tenfold increase in death for people who had a chronic disease compared to people who did not have a chronic disease. Now, the graph on the right is the same kind of data with Italy, but here, instead of individual chronic diseases, it's grouped into the number of chronic diseases. So people who had a lot of chronic diseases, the percent of the people who died in Italy, close to 50% of them had 3 or more chronic diseases. And then you can see if you had 2 chronic diseases, it was less. 1 chronic disease was somewhat similar to 2 chronic diseases, but a little less. But again, if you had no chronic diseases, the chances of you actually passing away, the chance of you actually dying from COVID-19 was very, very slim. So to the no chronic disease to the 3+ chronic diseases was way more than 10 times. It was closer to 50 times the chance of dying if you had multiple chronic diseases compared to if you had no chronic diseases. The same kind of data has played out in the US. So the Centers for Disease Control recently made this statement. People with underlying medical conditions such as heart disease and diabetes were 6 times more likely to be hospitalized and 12 times as often as those with underlying conditions to actually die. So again, these chronic diseases are something that are very significant as far as whether you get COVID-19 and as far as how well you do with COVID-19. And you know, I'm in this area called lifestyle medicine. Our practice is called Lifestyle Medical. There's a whole movement going on around the US and around the world around lifestyle medicine. And interestingly, one of lifestyle medicine's premises is that you can actually reverse some of these chronic diseases. So diabetes is not a lifetime diagnosis. You can, if you do the right things, if you make the right choices, you can actually reverse them. So it becomes very important to apply lifestyle medicine during the coronavirus epidemic because we're very interested in reversing some of these chronic diseases. So again, we'll talk more about how we can do some of those things towards the end. So we said we were going to make 3 recommendations as far as what we can do to keep ourselves safe in the new normal. So this is the first recommendation I make. Know who you're getting close to. Now, this is a challenging recommendation in a lot of ways, but it's also a very important one. I think it's not something that we spend enough time talking about when we see the messages that are coming over the social media. So we've heard about this concept of a social bubble. The concept of a social bubble is literally to know who you're getting close to. And what do you need to know about them? Well, you need to know 2 things. One is you need to know how they're feeling. If you want to be really cautious, you're going to take their temperature. That's what we do in our office. Every employee, every morning when they come to work, they get their temperature taken. We also in our office check their pulse oximetry. And then there's a series of questions. How have you been feeling? Have you had a cough? Have you had any of these symptoms, any shortness of breath, any of these symptoms that we know go along with coronavirus? So that's the first thing you need to know as far as the people you're interacting is, have they been sick? But you also need to know what exposures they've had. So I had a patient the other day who had a daughter who was going out to the bars. And this patient said, I told my daughter she can't come to our house. And I fully supported that. So if someone's participating in risky behaviors, you don't want that person around you because that person may be early on in the disease, not have symptoms, or be one of these asymptomatic carriers. And that person can get you sick without you ever knowing that they were sick. So you have to know the level of illness or how someone's feeling, but you also have to know what kind of exposures they've had. And if they're people who aren't being cautious, you don't really want them in your social bubble. So you can create this social bubble, but then you have to keep track of what's going on with that social bubble. So maybe a friend of yours that you want in your social bubble, you've gone through the questions and it feels like they're being safe, but then over time their behavior starts changing. You might have to take them out of your social bubble. But it's valid to have a social bubble, to know who you're getting close to, and those are the people that you're getting close to that you trust. Those are the ones that you can really have that deep relationship with. So that's guideline number one. Guideline number two is when you do go out. So all of us don't want to be in our social bubble all the time. It's very hard to be isolated in your house all the time. So we want times where we go out. And when we go out, if you're going out into an open air environment where there's not a lot of people around, that's fine. You can go out there. You don't need to wear a mask. You don't need to be worried about getting coronavirus because, again, coronavirus spreads through these respiratory droplets. These respiratory droplets don't go really more than 6 feet away. There may be an occasional cough or sneeze where it'll get further than that, but generally, even with coughing and sneezing, they don't go more than 6 feet, which is why we have this guideline of staying 6 feet away. So if you're outside and walking around and nobody's within 6 feet of you, you can feel pretty good that you're keeping safe from coronavirus. And that's sort of the scenarios you want to go into. So this public social distancing does really matter. Which leads us to the third guideline. The third guideline is that there are times when we go out where we are going to be closer than 6 feet from people, and hopefully not for long periods of time. But let's say you go to the grocery store, or let's say you go to some other store, or you go to like I do. You're walking up Mount Rubidoux. There are times you may get closer than 6 feet to people like that, or in those kind of situations. And when that's the case, you need to wear a mask. It's the polite thing to do. It's obviously the law again now here in California, and it's that way because it protects you as well as the other person. So I don't know if you can read this little cartoon on the right, but I just think it's the perfect example. This has been around a little bit, so you maybe have seen this already. But it talks about how the urine test is like the mask. So basically, the first illustration there is two people who are walking around naked. And the example there is that if you're walking around naked and somebody pees, the other person's going to get wet right away. So obviously, we don't do that in our society, and there's good reasons why we don't. But if you're someone who wants to protect yourself, then you're going to wear pants. And then if another person's walking around naked, if they pee, you're going to have some protection. You might get a little wet, but you're not going to get it as quickly and as directly and as much as if you were naked. So wearing pants protects you. But obviously, the thing that protects the most is if both people are wearing pants. Because then if the other person pees, then very little of their pee is going to get on you. It's going to mainly get their own pants wet. Now, they could still rub against you, so theoretically, you could still have some exposure to the pee, but you're basically not going to get it. So it's this more or less exact same scenario with a mask. So if you wear a mask, you're going to be protected some from some of these respiratory droplets, but you're not going to be protected near as much as if the other person's wearing a mask and you're wearing a mask. And then you're relatively confident that those respiratory droplets aren't going to get on you because they're going to sort of stay within the mask of this other person. Again, I know masks, there's a little bit of controversy around that. I'm personally grateful for Governor Newsom to sort of take the bull by the horns and say, this is just going to be a state guideline. I think that's the right message to be giving. And do I like wearing a mask? No, I actually hate wearing masks. They're not fun at all. But it's what we need to do. It's what we do every day as we're interacting with patients. Again, you don't need to wear the mask if you're outdoors and more than 6 feet away from people. But if you're in an indoor situation and there's a chance you're going to be within 6 feet of people, wear the mask. That's the right thing to do. It's the appropriate thing to do. So those are our 3 guidelines. So again, guideline number 1 is know who you're being close to, have your social bubble and know who you're being close to. Guideline number 2 is to maintain that social distance. That actually does matter, and it's an important thing. And we need to keep thinking about that and keep ourselves in situations where we can keep that 6-foot distance. But then when there's a chance you're going to be less than 6 feet from people, just wear the mask. There's obviously other things that we can do. So the concept of good hygiene, that's important. This is the idea of washing your hands, not touching your face, all of those kinds of things. That's important. As we talked about earlier, it's not as important now as we used to think it was, but it's still very important. Keeping your environment clean, so just wiping things down and not having a lot of dust and other things, that's still important. Again, not as important as these 3 other things, but still very important. And then this idea of improving the ventilation in the places that you're going, that matters too. So if you need it in your house, figure out ways to improve the ventilation in your house. If you're going to a store, you want to go to stores that have high ceilings and good ventilation. You don't want to go to stores that are cramped and crowded and sort of push people together. So this ventilation improvement idea is something I suspect there's going to be new industries over the next year or 2 that will be helping people to improve the ventilation in the places that they live and work and interact. So this gets us to our last slide. And like I said, our practice is called Lifestyle Medical. In Lifestyle Medical, we're passionate about trying to reverse chronic disease. We feel like the science is quite clear that frequently you can reverse chronic disease. And so we really work hard to try to help our patients. And we have 4 pillars to do this. We don't have time to go into the details of each of these four pillars, but just in summary, the first pillar is nourishment. So there are lots of things that we can do food-wise that actually help us reverse chronic disease. Diabetes is specifically a food-borne illness. The reason that there is a diabetes type 2 epidemic is directly related to the amount of processed food that we eat and just our nutritional patterns. So eating lots of vegetables is very, very important. It's especially important in this coronavirus time frame because it's those veggies and those fruits that give you the high vitamin C levels. It's also beans and nuts and seeds that give you high zinc levels, high vitamin C levels and high zinc levels seem to protect ourselves from coronavirus to some extent. So having lots of vegetables and fruits, and then again, staying away from the highly processed foods, the foods that have lots of sugar and lots of white flour, lots of oil. Those are the things that are dangerous. And a dietary change can go a long ways towards reversing chronic disease. Our second pillar is movement. So that's exercise, the idea of staying active. Initially with coronavirus, some of us isolated in our houses probably a bit too much. We need to not be isolated in our houses. We need to be getting outside. Nowadays, around here, it's getting warmer, so your chances to be outside are more in the mornings than the evenings. But take advantage of those opportunities. Go outside, go on a walk. Still socially distanced. Still be safe. But we can incorporate movement into our life in ways that are very important as far as improving ourselves and improving our immune system and decreasing our chronic disease risk factors. Our third pillar is what we call resilience. Resilience has 2 main components. One is getting plenty of rest and sleep. The other is managing your stress. And stress is not necessarily a bad thing, but if we don't manage it well, it is a bad thing, and it will directly affect your sleep. So this idea of renewing ourselves and giving ourselves the stress management tools and the rest that we need is very, very important as far as, again, maintaining our immunity and decreasing our chronic diseases. And then our final pillar is connectedness. This has been one of the hardest ones in coronavirus, because coronavirus tells us to socially distance. It tells us to quarantine at home to some large extent. So we in our practice, we used to have a lot of groups. Now all of our groups are like this. They're Zoom meetings, but we still have those groups because connectedness is very important. And connectedness, having those social connections actually does decrease your risk of chronic disease and does improve your immune system. So finding ways within coronavirus to have that social bubble that you feel safe in, and to stay connected is important. And connectedness is not just the horizontal connectedness. It's also what we call vertical connectedness, where you're having purpose and meaning in life. You're applying the spirituality that you have in your life and staying connected that way as well. So those are our 4 pillars. Those are the things that we help our patients work on. Those are the things that I encourage you to work on as far as keeping your immune system strong and decreasing your chronic disease risks, or even reversing chronic disease if you have them now. If you apply those in your life on a day-to-day basis, if you use the 3 guidelines that I mentioned earlier, hopefully you can stay safe from a coronavirus situation, and hopefully you can enjoy life. Hopefully you can thrive in life. You can flourish and really just live the life that you want to live despite this coronavirus epidemic. So that's the end of the slide presentation. So I'm going to turn it back over to Lori, and she's going to share a few things with us, and then we'll have the question and answer session. Again, if you have questions, please just type that into the chat box. I see we have some questions coming in. Please, others, just keep adding your questions as we go along.
Thank you, Dr. Dysinger, and thank you for giving us a little bit more perspective on how we can have some control over this. It seems like if you watch the news every day, it just seems out of control, and so I appreciate your perspective on that. I'm going to give you just a few slides about our new emergency department, which we opened here at Parkview in November of last year, and some would say just in the nick of time. Our new emergency department is 18,000 square feet, which is triple the size of our old emergency department. We have a total of 43 beds now. Where you see that ambulance sign, that is a private entrance for EMTs who are bringing patients in on ambulances. And then at the front there, you see the patient entrance, which is for those walk-in patients. And I want to emphasize that you've probably read in the news that many people are self-treating at home and avoiding coming to the emergency department for severe illnesses and situations like heart attacks and strokes. We have seen a decline in the number of patients who are coming in for heart attack and stroke symptoms, but there is no way that heart attacks and strokes went away when COVID-19 showed up. So we want to encourage you, and I'll give you some information on what we're doing to keep you safe. If you need to come to the emergency department, please don't delay if you have a life-threatening illness. This is an overhead of the new building. The brown building on the right there is our old emergency department, and the white building is the new emergency department. This is the lobby, which we have separated into 2 sections. So if we have patients who are identified before they enter as having symptoms of COVID-19, they are cared for separately from those who are non-COVID symptomatic. We have wide, spacious hallways, and on the left there you see that the doors, those metal doors and glass doors are private rooms for the patients that we treat, and these would be our non-COVID patients. There you see again a private room, and here's what the room looks like on the inside. This is one of our high acuity rooms where we're a stroke receiving center, so if you were to have a stroke and be brought in, you would be treated very capably here. Again, I want to emphasize that we're taking many precautions to keep our patients and our staff safe. So everyone is screened before they enter the building. We take temperatures, we provide masks for everyone. We have separate screening areas in our emergency department for COVID and non-COVID patients. And I mentioned earlier that some would say in the nick of time we opened our new emergency department, because that left our old emergency department available. And we've turned that into a special treatment unit, which is negative pressure areas for the treatment of our COVID-19 patients. So they are all cared for independently and separate from other patients in the hospital. Patients who are here for surgery recover on a private floor where they are not exposed to COVID patients. And our maternity entrance, we've created a private maternity entrance for our new moms and their support person and our physicians and staff. So everyone who treats a maternity patient enters through that private area. And they, of course, are all screened before they enter the building. So those are some things that we're doing here at Parkview. And if you have other questions about concerns about getting necessary treatment during COVID-19, Dr. Dysinger, I'm sure, can answer those. So I'll take you back to the slide with the information on it where you can contact Lifestyle Medical and Parkview Hospital. Thank you for attending.
Thank you, Lori, and it's wonderful to know that within our community we have a emergency facility that has that level of technical expertise, personal expertise, and so again, ways to contact Parkview Hospital as well as Lifestyle Medical are on the slide here, and we have time for questions. We have one question that's come in. So this is a question by someone who's saying that they had some work done at their house. And so there was people that weren't part of their social bubble, it sounds like, that were coming into their house. And this person is saying while the workers were there, she did open the windows, or I don't know if it was a he or her, so he or she did open the windows. And they did that because they wanted to increase the circulation. So they had good circulation while these workers were there. And then after the workers left, they sprayed Lysol in each room. So the question is that a good idea? And it's a great question. And of course, it is a great idea. So we talked about circulation being important. One way to improve circulation is to have ventilation to go in and out. So the inside air can go out, the outside air can come in. We do know that that's very important. And it will, again, we talked about the dose mattering. And so if you have the ventilation going on, there's not going to be, if someone's sick, it's not going to be sort of settling or staying in the air as long. It's going to sort of just move right through. So that was a great idea to open the windows. And that's what all of us need to be thinking about if we're in a situation. Now, I have to say, you can debate shutting down businesses, whether that's good or bad. But I do not find a way I can feel comfortable for myself or for my family members where there's large groups of people in a closed environment. So going to gyms, that feels risky to me. Of course, now I believe gyms are all closed down again, but I was happy to see gyms closed down again because I couldn't envision a way that a gym could be safe. Maybe if there's just one individual in there at a time, or maybe two people long ways apart. Now, I'm sure gyms will look at ways of improving circulation and getting social distancing. So there's maybe a time in the future where gyms are going to be just fine. But for now, I'm very concerned. So in this question, the other component of the question was, spraying down with Lysol. And obviously in our office, after a patient is seen in our exam room, we will wipe down the whole exam room. This is even for patients that don't have any risks of coronavirus or any symptoms of coronavirus. We still do that wiping down. Now that's maybe a little bit of an overkill, knowing what we do know now about coronavirus, but we still take that precaution. Obviously, we're a medical office, and there's very little harm in taking that precaution like this questionnaire did in their house. So they just wiped things down. So those are the kinds of things that we need to be doing. So I don't know if there's any other questions that are out there. In my office all the time, I'm getting asked questions about timing of coronavirus. So if you're exposed, how long does it take to get symptoms? If you're exposed, how long does it take to positive? So just a few answers to those kind of questions. So if you get exposed to coronavirus, you don't test positive immediately. So it takes a day or two for your test to turn positive. So if you were around someone that coughed on you and then you found out within an hour that that person that coughed had coronavirus, if you went and got tested that very next hour, you wouldn't test positive yet. But wait a day or two, and then that's when you would test positive. Usually the symptoms of coronavirus don't start until day 4 or 5. So if you got exposed and you did get the disease, you would feel fine the first 2 or 3 days generally. But day 4 or 5 is when the coronavirus is strong enough in your body that you start getting symptoms, and then it's usually this dry cough, a little fever, maybe some shortness of breath, a variety of other symptoms. We've heard about it affecting our sense of smell and sense of taste, and it can cause a little GI upsets at times, lack of appetite at times. So there are a variety of symptoms, but those symptoms tend to come on day 4 or day 5. And then usually it's a 4 or 5 day disease, and then you're feeling better, so, sort of like the flu, sort of like a cold. But then there's a percentage of people who do poorly with it. Their immune system is not strong. They have a heavy dose of the virus, and those people who do poorly, they usually start doing poorly around day 5, 6, 7. So they didn't get quite over the hump, and instead of getting better, they actually go down and they get worse. So that's another time frame when we have our patients with COVID. You want to watch them very carefully around that day 4, 5, 6, 7, because if they start doing worse, that's where they need a little oxygen and need a little support. And then sometimes you can get them through that. And again, I don't treat patients in the hospital much, but the doctors that treat patients in the hospital have learned the antivirals and the prednisone and some of these other medications, so that people that are really sick, they have a little better chance of doing well now compared to back in April, when we didn't know some of these other tools that physicians can have to help people do better. So we've had another question come in, and this one's talking about the mutations for the coronavirus. And the question is it getting more or less aggressive? So my first answer to that is, based on everything that I've read, the mutations so far aren't really changing the aggressiveness of the virus. So I have not read where it's getting more aggressive or getting less aggressive. There are some mutations that are going on out there with this virus, but they don't seem to be that significant as far as how the virus is affecting the human host. Now, some discussions on that. If you looked at the first set of data that was coming out of China, it said about 4% of people who get the virus would die. So that's a pretty high death rate, 4%. So one out of every 25 people who get the virus is going to die. So if you look at the data that's coming out now, it seems to be much less than that. Maybe a quarter of that, or maybe a sixth of that. So it's looking like now it's maybe about 0.6% of people who get the virus die. And why is that? Well, it's several reasons. One is we've learned that the virus is most dangerous in the older population. The older population is, because of that, the older population is taking more precautions. The younger population is less worried about it. They're taking less precautions. So a higher percentage of the population that's getting the virus is actually younger and people that do well. So that's one reason the death rate seems to be dropping. Another reason the death rate seems to be dropping is that we are a little better at treating it. So people who start getting sick, we know we have a few more tools in our armamentarium that we can do to help treat them. And so those are the reasons why the virus seems to be, you could say it's less aggressive, but it's not really less aggressive. It's just a different mix and a different level of treatment that we have available. And I just want to point out another statistic. Some people sort of say, well, eventually everyone's going to get it. And eventually, everyone's going to, we're going to sort of get herd immunity. And why should we worry about it now? Well, in Europe, Sweden, the country of Sweden, took that approach. And Sweden did much worse than the rest of Europe. So it doesn't seem like that approach works. Another statistic you can do, if one out of, so if, say we're at this 0.6%, this 0.6% death rate, that's approximately one death out of every 300 patients who have, actually, no, that would be one death out of every 200 patients. But for statistical purposes, let's just say there's one death out of every 300 patients. In the US, there's 300 million people. If you had one death out of every 300 patients, that would be 1 million people that died. So if everybody in the US got coronavirus, you'd have 1 million deaths. We don't want 1 million deaths. We already have 130 and going on 140,000 deaths. We don't want 1 million deaths. We don't want 10 times the number of deaths that we currently have. So we have to keep doing things to be safe, even though this death rate seems to have dropped significantly. So another question, how safe is it to have dental work during the epidemic? And I think that's a great question, not just around dental work, but around a variety of things that we want to be doing, around simple things like haircuts, or more complicated things like, should we have a colonoscopy? Back in April, we didn't encourage any of our patients to even get labs drawn because there were just so many unknowns and it just didn't feel safe. Now for our patients, we're encouraging them to have labs drawn. We're encouraging them to get their routine medical care done. That's important. And the healthcare system has learned how to stay safe. So if you go to LabCorp or Quest Labs, I'm sure at Parkview, their lab system there, they've figured out what to do so they can draw the labs and stay safe for the patient and stay safe for the facility. So dental work, it's a fuzzy area. I'm probably not going to encourage my patients to spend. I mean, I know for me personally, I'm overdue for my general dental cleaning, and I'm not trying to schedule an appointment anytime soon for my general dental cleaning. Obviously, if you have more significant dental work done, that's limiting your. I mean, if you have significant dental needs that are limiting your ability to chew or in some other way affecting the function of your life, then go ahead and get that dental work done. Routine work that's more on the cosmetic perspective, then I think you need to be very cautious. Now, I know some dentists are requiring their patients to be tested for COVID-19 before they'll treat them. So that's one of the ways that the dental profession has taken precautions to be safe, so that they know that COVID is not in their office and they know that COVID is not in the patients that they're treating. So you can go to a dentist like that who is being extremely safe, and probably you can be safe in that environment. But that same question again, it goes for a variety of different health questions, and it's going to vary from person to person. People who are at high risk want to continue to take extra precautions. So if you're over 70, especially if you're over 80, you have multiple chronic diseases, you're doing less things than the person who's 35 and doesn't have any chronic diseases. So another question, are there any medications that are promising? And the answer to that is yes, there is. So there's an antiviral medication. You probably heard about it in the news called remdesivir, and that antiviral medication does seem to have some effect. Now, I will say that we've obviously had viruses around forever. We've had the HIV virus, we've had the herpes virus, we've had viruses that are pretty bothersome. In case of HIV, that was deadly. So we've worked for decades trying to find ways of having antivirals that are very strong. And we've never found one. We don't have any antiviral that actually kills viruses. What we do have is antivirals that will slow down viruses significantly. And with HIV, we've gotten far enough along the path that HIV is not a deadly virus anymore. Most people who get the HIV virus, if they take their antivirals on a regular basis, they can keep it under control. So we don't have an antiviral. I don't expect an antiviral to be developed that will kill coronavirus. At the least, it can decrease the chances of you going into the florid respiratory failure that actually kills people. That's the best we can hope of those. But we have other medications. So again, we've learned that prednisone can help people get through some of this inflammatory response that seems to come before people go into their respiratory failure. So low dose prednisone does work. This remdesivir does work. And then there's a variety of other things that are being tested. Everyone's heard of hydroxychloroquine. I've not seen anything that made me convinced that really offered that much benefit. But there's a variety of other medications that are being used and tested. And I'm sure over time we're going to get better treatment for coronavirus. Another question that comes up is the vaccine. And again, if you keep up with the news, you probably heard that a vaccine is going into its final phase of testing here just over the next few weeks, which is really, really good. And the first phase of testing for this vaccine was quite promising. The final phase of testing involves several thousand patients, and it takes a while to build the immunity. This is a 2-phase vaccine, so you get it once, and then a month later you get another dose of the vaccine, and then it takes 3 or 4 months for you to build your immune system so that you'll be protected from the coronavirus with this vaccine that they're being tested. So we'll know towards the end of the year if this vaccine is actually going to have some benefit. It looks promising. If it does have some benefit, obviously the next step is to mass produce it and then to mass distribute it and get it available to people. So there's a chance that 6 months from now, we could have a vaccine that's promising. But again, you're not going to be immediately protected from the coronavirus. You need both doses, and you need some time for that immunity to build up. So another question that came through, and this will probably be our last question, and then we'll shut down. So this question is about school reopening. Do you feel it's safe right now? So I'll say I have a daughter going into her freshman year of high school, and a son who's in middle school. And literally last night, we spent the whole evening listening. We're in the Redlands Unified School District, and we spent the evening listening to the board meeting of the Redlands Unified School District and their discussion about reopening. It's a really, really challenging situation. You obviously have some people who say, I'm a single parent and I have to work, or we need both parents working for us to survive economically. We have to have a place where we can send our kids to school. And that's especially tough if they're elementary school kids. But on the other hand, you can imagine if you have a bunch of kids in a classroom, the way coronavirus is spreading around, over the course of a school year, one of those kids is going to get coronavirus. It's almost bound to happen. And if they get it and they're all together in a classroom, the chances of it going to everyone else in the classroom is very high. And then we've talked in our family, say our son gets coronavirus, he comes home sick with coronavirus. What are we going to do as parents? It's hard to isolate a 12-year-old in a room by themselves. So my wife's already said, well, if he gets it, I'm going to be there with him, and I'm going to get it too. And then, I mean, these are very challenging situations, and it's a challenging time that we live in. So I don't have a good answer to school reopening. I do think there's a lot of risks in it, and to be honest, it doesn't feel fully safe to me right now. I can't come up with a scenario that feels fully safe, but yet, if you don't reopen schools, there's so many challenges with that. So what our school district is doing is where they're going to be week on, week off. So my son and daughter will go to school for a week, and then they'll do distance learning for a week, and that seems like that's the direction they're going. And that way they have half the number of people in the classroom. Some people will be, if you want to do full distance learning, you can do that, and so they may have only a third of the number of people in the classroom, and that's probably about as good as you can get as far as safety. And as far as something that works, there are going to be a lot of people that are unhappy with that, but it is what it is. So with that positive note, I think we'll wrap up. I don't know, Lori, if you have anything else that you want to say, but I thank you all for participating. I thank you all for your questions. And just as a reminder, we can stay safe in the coronavirus epidemic. Just follow those 3 guidelines, have your social bubble and know those people well. Keep your social distancing when you're outside of that social bubble. Wear masks if you're in a situation where you might be closer than 6 feet from people. And then do what you can to build your immunity so that if coronavirus does hit home, if it comes into your household, if it comes to you, you give yourself and your body the best chance to do well with it. So again, thank you, and please, if you have further questions, call us at this number, or call Parkview, or visit us at our website. You can email us at info@lifestylemedical.com, and we'll go from there.
Great. Thank you all for attending this webinar, and it's going to be a long time, I think, before we have in-person seminars again, the way we were so accustomed to meeting with you all. So please check your mail and our website, and we often post on Eventbrite and certainly on Facebook. Follow us on Facebook for more information. We have several seminars, webinars scheduled through the end of August at this point. So thank you for attending today, and we look forward to seeing you again soon.